in one of the previous podcasts, I've interviewed an orthopedic surgeon, and we were talking about why there is no muscle mass, mainly in women. And he was mentioning that he is seeing a lot of hip fractures, and including vertebral fractures, mainly in the postmenopausal women, where there is no muscle mass. So I was in multiple podcasts as well. I usually say that, as an Indian community, as we discussed, there is decreased protein to start with. On the top of it, we are not having any more strength training, any significant strength training. And on the top of it, we also have a tendency to put a central adiposity with the belly fat accumulation. All this is basically a recipe for disaster in terms of any bone problems, including osteoporosis, osteoarthritis and everything. You see a lot of vertebral fractures patients.
Correct.
Do you see a increased predominance in women as well?
Tremendous. Osteoporosis in the postmenopausal women is a serious problem. Many patients present with severe painful vertebral fractures, many of them requiring surgery, and the surgical options are not that simple in osteoporosis. So if you have to do a fixation, putting titanium implants, the ability of the bone to hold the implant in place becomes a question. So then we have to use special types of screws with cement, and it's not...
So you don't have that muscle to hold.
I think, like we were discussing offline also, it's time that women who are perimenopausal become seriously sensitized to the need to talk about hormone replacement therapy with their primary care practitioners and their gynecologists, and if not, their endocrinologists. Because that is the only way that we can obviate many of these problems. A lot of these women, postmenopausal women, have skipped that important period when they should have got hormone replacement therapy. But that ship has sailed, and now they have the effects of postmenopausal loss of estrogen, loss of testosterone, poor muscle mass, osteoporosis. It's devastating. The quality of life suffers tremendously.
Estrogen helps in bone mass.
Absolutely. Estrogen helps in bone mass, helps in cognition. It helps in sleep. It helps in glucose control. So many things. And it reduces the risk of cardiovascular disease and stroke, which is all something we see in postmenopausal women.
So in menopause, what happens is estrogen goes down significantly. And that's why you're not having any more menstrual periods.
Correct.
Interesting fact about fasting is during the first 14 days of a menstrual cycle, where the estrogen is peak.
Follicular phase.
You can fast like anything, whatever you want. You will not have the cravings. You will not have anything.
Wow.
The fasting period is like wonderful. You could even do like 16 hours, 17 hours, relatively easier. The second half, luteal phase, is where progesterone kicks in, and it's a sugar craving hormone. And that's why many people crave for ultra processed foods and carb rich foods around the menstrual period. Translating the exact same thing into your bone physiology, after menopause, there is no estrogen at all. And if you do not put the effort before, when your estrogen is acting, when you're producing the muscle mass, it's even more difficult to support your bone structure at the later part of time. So what you're talking about is supplementing that estrogen with hormone replacement therapy, where there is an option to increase the availability. And there was some controversy about, giving estrogen can increase the risk of breast cancer and increase risk of accelerated. There was some study on atherosclerosis. But it is a case-by-case evaluation where you have to discuss this with your primary care.
And now there are many options available in terms of hormone replacement. I think from whatever I know, and I'm not an expert in the field, but I think because I see the effects of low estrogen, I'm more concerned that women particularly should be asking these questions and seeking the right answers, because the options available now are plenty. There are not necessary to take oral estrogens only or injectable. There are patches, or creams and so on. And there are combinations, estrogen with progesterone. Depends on whether the person has a uterus or doesn't have. History of breast cancer. All that can be taken care of within the setting of hormone replacement therapy.
So I'm going to give you a scenario, okay? So let's say I am a woman between 25 to 45 years of age. Let's say 35 years old.
Okay.
I'm 35 years old. I'm watching Dr. Pal channel and I'm trying to learn all this health techniques and everything. I'm never into significant physical activity before, anything like that. What will be your recommendation to start with?
Important to realize that there's something known as, even bigger than primary prevention, primordial prevention. Basically, anticipate. Nowadays, if you're 35, the average life expectancy is somewhere around 70, 75. You're expected to live another 40 years. If your fitness is at a certain level today, it is only going to get worse from now on, because 40 is usually the time when fitness starts going down if you don't take measures to maintain it. So with fitness, lack of fitness comes all the lifestyle diseases. Your diabetes, hypertension, risk of cancer goes up, osteoporosis, cardiovascular disease, stroke, metabolic disease, fatty liver, obesity, visceral fat, all that stuff.
This.
Right? So there's tons of it.